So good evening, friends. Again meeting with the Organon session, and we have finished in last lecture the homeopathic management of one-sided diseases of internal origin. He has classified the one-sided diseases into two parts: the internal variety and the external variety, labeled by the name of local diseases, and out of which, in detail, the homeopathic management of internal variety of one-sided diseases he has mentioned. The symptoms are symptoms are there. And with the whole case taking aspect, you can find it out the right remedy for patient. And three possibilities which he has mentioned over there. The first possibility is those symptoms, these symptoms are characteristic enough at that time, they might produce a cure in that patient. That is one possibility. Second, most common possibility is that some symptoms vanish, some symptoms remain, and there arises new symptoms called as
Sir, voice is very low.
so accessory symptoms can be developed during that time. Hello. So accessory symptoms
Yes, sir, now okay.
which develops over there, and this totality, the accessory symptoms plus the original symptoms, and this new totality gives you a chance to find it out, a perfect totality to find it out a right remedy. And third possibility, there is complete paucity of symptoms and patient is in a benign state of mind and body. At that time, he has given third possibility that if you want to bring that patient into the life, the opium should be given so that opium stimulates the vital force to bring that patient into the again into the life, and then whatever the symptomatology comes, accordingly you have to find it out the right remedy for that patient. So all those three possibilities he has mentioned and how to approach in those cases of partial totality, that also he is explained over there in detail, and he completes the homeopathic management of those one-sided diseases. The second variety which we have to start learning in today's session is local diseases, or which are nothing but the one-sided diseases of external manifestation. Again, he classified those into two parts. So we'll start with aphorism number 85, that is local diseases. Among the one-sided diseases, an important place is occupied by the so-called local maladies, by which term is signified those changes and elements that appear on the external parts of the body. Till now, the idea prevalent in the schools was that these parts were alone morbidly affected, and that the rest of the body did not participate in the disease. The theoretical, absurd doctrine which has led to the most disastrous medical treatment. So now he starts explaining about the second variety of one-sided disease, and those diseases which appears on the surface of the body. So in the form of some skin manifestations, some external growths on the body, whatever it may be, which were considered to be a local diseases by the old school. And they consider these are local diseases caused because of local problem, and that's why their management, the allopathic management was local, and because of which the disease was suppressed at that specific local level and entered inside the body. Hazardous effects of local treatment was there because the thought was wrong. The thought was that these are the local diseases. That was the wrong interpretation, and because of which such hazardous management happened. When we consider homeopathically, even though they appears on the external most part of the body, the cause we used to consider is internal at the dynamic level. So if it is at the dynamic level, it is the expression which is getting expressed on the external most part of the body in the form of skin lesions or some local pathologies. Those are the results of internal dynamic disease. So your treatment should be aimed at the internal level, not at the local level. It depends upon how do you use logic and how do you consider exactly the things. If your thought is wrong, the treatment becomes wrong. If your thought is correct, your treatment becomes correct. Hahnemann explained that this is what happened with this allopathic science, and because of which a theoretical absurd doctrine which has led to the most disastrous medical treatment. So if there is a gangrene, they used to cut the fingers. If there is any eczema, they used to apply local ointments. If there is any psoriasis, they used to apply local ointments because they consider this is the local disease. And this doctrine itself was responsible to produce a disastrous effects over there. So local diseases are not local diseases. Actually, they are the part and parcel of the external vital force expressing externally on the skin. And then he explains there are again two varieties of local diseases. So he starts in 186. Those so-called local maladies, which have been produced a short time previously, solely by an external lesion, still appear at first sight to deserve the name of local diseases. So, two types of local diseases. First variety, local diseases caused because of external cause. So, in the form of a trauma, if it has happened. So, this is because of external cause. So, your logic, your treatment becomes different. So, that's why he classifies again the local diseases. Local diseases because of external cause and local diseases because of internal cause. But then the lesion must be very trivial, and in that case, it would be of no great moment. For in the case of injuries accruing to the body from without. Accruing means लागणं, एखादी गोष्टीची इजा होणं, लागणं. That is called as the accruing. Accruing to the body from without, if they be at all severe, the whole living organism sympathizes and there occur fever, etc. So he explains over there, even though the trauma happens to be there, a trauma is, if trauma is trivial, very small, it will not affect that human being to great level, and then that becomes a local manifestation and it disappears by its own. But if that trauma is a bigger one and causing a bigger damage, then at that time, that human being, even though he has affected because of external cause, the internal dynamics also gets disturbed because of which. And at that time, there are two things happens. The local malady also develops and internal disturbance of that human being also happens. This is what he is explaining. And there occur the fever, because of which the fever can develop. The treatment of such diseases is relegated to the surgery, but this is right only insofar as the affected parts require mechanical aid, whereby the external obstacles to the cure, which can only be expected to take place by the agency of vital force, may be removed by the mechanical means. Example, by reduction of dislocations, by the needles and bandages to bring together the lips of wounds, by mechanical pressure to still the flow of the blood from open arteries, by the extraction of foreign bodies that have been penetrated into the living parts, by making an opening into a cavity of the body in order to remove the irritating substance or to procure the evacuations of the effusions or collections of the fluids, by bringing into a position the broken extremities of the fractured bone and retaining them in exact contact with the appropriate bandages. So he is explaining that if this local malady, which is developed because of some external cause, what requires is the mainly the external surgical treatment. For example, if the trauma is so severe that it has broken the bones and there is a fracture, and this fracture is a complete fracture where there is a dislocation of both ends, it is necessary to reduce that. Then it is possible that they can get united. Otherwise, they never gets united. Second important thing is that if there is a big injury causing lot of bleeding, then you have to suture that injury. So these are the surgical measures which you have to develop. We have to do because the cause is external. It is not purely dynamic disease. The dynamic effects can happen on that individual. If those happens, you have to treat with the help of internal medicine along with that. But first important line of treatment at that time is the surgical aid if it has been needed. because cause is external and not the internal. But when in such injuries, the whole living organism requires, as it always does, active dynamic aid to put it in a position, to accomplish the work of healing. Example, when violent fever resulting from extensive contusions, lacerated muscles, tendons, and blood vessels, and requires to be removed by the medicine given internally, or when the external pain of the scalded or burned parts needs to be homeopathically subdued, then the service of dynamic physician and his helpful homeopathy come into the requisition. So here in this aphorism, he explains both the things. He has explained exactly what he expects in the local disease. When local disease is because of some external cause, the first line of treatment is always a local means in the form of some surgical measure. So if there is a big injury, if there is a big gap, you have to suture. If there is a fracture, you have to reduce the fracture. If there is a dislocation of the joint, you have to again relocate that with the help of surgical aid. So here plays the role of surgery first. But if trauma is so severe that it affects the internal dynamics, producing the fever over there, sometimes the even mental disturbance also, the fright also, in such types of cases, those surgical measures will not do anything. Here, the help of homeopathy is needed. And in such types of cases, along with the surgical measures, you have to add homeopathic management. Then the role of homeopathic physician also comes. So, first line of treatment is very important, the dynamic one, sorry, surgical one, followed by the dynamic homeopathic remedy based upon law of similars. So just in short, you can write over there the local malady due to the external cause. First, in the aphorism number 86, you write the local malady due to the external cause. Homeopathic management is equal to auxiliary measures plus surgical measures plus homeopathic simile. Three things: auxiliary measure plus surgical measures plus homeopathic simile. What do you mean by auxiliary measures? Auxiliary measures means if a person requires a support, for example, he wants a sling, this is the auxiliary measure. If patient requires the cervical belt, it is the auxiliary measure. If patient requires anywhere the support on the body, that is the auxiliary measure. So when cause is external and things require the support, the auxiliary measures plays the role. Second, surgical role in the form of making a suturing, gaping or healing the gaped wounds with the help of suturing, reducing the fractures, or surgically reducing the fractures, relocating the dislocated joints. All those things comes into the role, and that is what is the surgical aid. And third important thing is if the trauma is big enough to produce the dynamic internal effects, then the patient requires dynamic homeopathic remedy. So secondary effects caused because of external injury can be treated with the homeopathy, and we have ample remedies. For the healing purpose, there is no medicine in allopathy. We have ample remedies. For local granulation, the calendula is the best remedy to be utilized. In fact, it is the only remedy where even non-healing ulcers are there, non-healing wounds are there. You put the calendula mother tincture directly over there and see the changes. It produces the granulation. We have the good remedies to for the surgical wounds. For example, staphyagria. If there is a big trauma, which is blunt trauma producing the ecchymosis, petechial hemorrhages, the arnica is there. If it is the nerve injury, we have the hypericum over there. If the injury is pinpointed, we have the ledum pal in our hand. If the wounds are lacerated, producing more burning, the calendula is important. So there are many more remedies which we have for the healing purposes. So it doesn't mean that homeopathy never plays a role in local diseases due to the external cause. Homeopathy plays a major role in such types of cases. For getting absorbed that hematoma. Allopathy doesn't have a remedy. We have arnica. Arnica absorbs the blood. Even there is a head injury, arnica plays a very vital role if you give instantly after the head injury. It stops the bleeding as well as if there is a bleeding, it absorbs the blood. Both things can happen with the help of arnica. So such a big remedy is there in your hand, which has the capacity to absorb the hematoma. So we have varieties of remedies to treat such disorders. And along with that, if any similimum is needed, depending upon the patient's presentation, that we can provide. So this this is what he wants to explain over there in this aphorism, that local malady due to the external cause requires three types of measurements. First is auxiliary measure, the second is the surgical measure, and third is the homeopathic simile. And second variety, which he tries to explain in the next aphorism, that is aphorism number 86, 187, that is local malady due to the internal cause. See, this is in fact one has to understand, because it is not because of something external which is causing the damage, but it is something which is internal producing the problem. So 187, we'll read this and we'll finish with today's session. But those affections, alterations, and elements appearing on the external parts that do not arise from any external injury, or that have only some slight external wound for their immediate exciting cause, are proved in quite another manner. Their source lies in some internal malady. To consider them as mere local affections and at the same time to treat them only or almost only, as is where surgically, with topical application or other similar remedies, as the old school have done from the remotest ages, is an absurd. Absurd म्हणजे असमंजसपणे केलेली कृती. Is an absurd as it is pernicious in its results. Pernicious means harmful. So what he is saying? Now there is a second variety of local diseases where the cause is not external. The cause is internal, dynamic. The cause is internal dynamic derangement of the vital force happened because of some any dynamic noxious agent. And if it is there and it gets expressed on the external most part of the body in the form of a psoriasis, in the form of a lichen planus, in the form of a eczema, in the form of a tumor, anything which expresses externally but cause lies inside. Those diseases where cause lies internally, and if you treat by the local means, as allopaths do or as the old school do, that disease always gets suppressed over there. It transforms from that organ. The skin is the very comparatively not a vital organ as the internal organs are there. And that's why the disease is always thrown on the external most aspect. But if you treat it, if you treat them locally, that enters inside, that goes inside, causes a damage internally, and then it becomes pernicious, harmful to that human being. The old school or allopathic school still till today used to treat such local measures always with the local treatment. So eczemas are treated with the local ointments. The psoriasis is treated with local ointments. Lichen planus is treated with the same way. All skin manifestations are treated locally, or all skin tumors or some growths or some local problems which are caused because of internal things always getting treated with local measures in allopathy, and because of which we have ample pernicious hazardous effects, internal effects of in those human beings. So Hahnemann explains over there, if the cause is internal, you have to treat it internally. So what exactly requires and how to treat, that is a big part which we have to learn. I think today we'll stop over here and we'll continue with the homeopathic management of this variety of local diseases due to the internal cause in the Monday session. Tomorrow there will be holiday, tomorrow and Sunday. On Monday's session, we will discuss this homeopathic management of local malady due to the internal cause. So that's all for today. If any questions are there, we can have a chat, and if it is not there, we'll stop the meeting. So any query, question?
Hello, sir.
Yes.
Sir, which potency of arnica should be used at first when we don't know the depth of injury to the head?
Basically, head injury, if it is severe and it is acute, always give 200 or 1 m. 1 m is the better potency to be utilized. 1 m is good, and it should be given in repeated doses. First 3 doses first immediately, and later on you can continue with it 3 times a day. Even you can repeat it for 10 days, 15 days also.
Okay, thank you.
You use local calendula for as a healing agent. Calendula in mother tincture form work better. And if you want to use ointments, then calendula by SBL is the only ointment which is useful. Because when you put SBL local ointment, calendula ointment, it gets dissolved over there. Which rest of the other ointments which I have seen, they never melts. Melting is necessary, which happens with the calendula ointment by SBL.
Sir,
Sir, the
usually,
tincture of calendula is very much burning in
Yes, it burns, but it is for time being only. Within a minute, it stops. Yes,
sir,
Ali.
यूजुअली बेड सोर्स में जो है वो कैलेंडुला बहुत अच्छा काम
Yes,
करती है, तो उसमें वो हम इंटरनली भी कैलेंडुला दे सकते हैं.
जरूरत नहीं पड़ती. Local calendula, if you apply mother tincture form, it works beautifully. No need.
अच्छा सर, अभी जो हमने एफोरिज्म पढ़ा उसमें ये था कि अगर एक्सटर्नल कॉज होगा तो हम उसको एक्सटर्नली यानी कि हम ट्रीट करें, लेकिन एट द सेम लेवल पे अगर उसका मेंटली भी कुछ इमोशनल लेवल पे भी कुछ चेंजेस हैं तो फिर हम पैरेलल तो उसको देखते हुए भी हम कुछ कॉन्स्टिट्यूशनली दे सकते हैं.
हाँ, definitely. If there are dynamic effects happens internally, you must give it. This is needed.
Right.
Okay. Yes, Hardik.
हेलो सर. सर मेरे पास एक पेशेंट है, 7-8 साल से वो इंसुलिन पर है, तो हम कितने एक्सटेंट तक हम होम्योपैथी से मैनेज कर सकते हैं?
What's the age?
एज 57.
57.
हाँ,
First,
और मल्टीपल डिजीज है, हाइपरटेंशन, किडनी फेलियर
if you
सब.
are treating that case, you have to treat constitutionally basically, and
ओके.
the patient should follow the diet. The diet for diabetes is very important. If he follows very specifically, you can reduce the doses of insulin in such types of cases. Many a times, patient might not require the insulin if you treat them in a proper manner. But if it is completely type 1 diabetes mellitus or if it is juvenile diabetes mellitus, the insulin is needed. It depends on what type of diabetes it is there. Type 2, you can completely prevent, but type 1, it is rather difficult. If you treat properly, many times you get very good results in such types of cases.
ओके सर, अब कंस्टिट्यूशन रेमेडी से सर हम पेशेंट को मेडिसिन पर कन्वर्ट कर सकते हैं क्या?
Yeah, definitely.
इन केस में हम एलएम पोटेंसी वी कैन यूज.
Hmm?
एलएम पोटेंसी यूज कर सकते हैं क्या?
LM डिपेंड्स. आपको ससेप्टेबिलिटी लो होंगी, आपको रिपीट करना चाहिए तो डेफिनेटली कर सकते.
ओके, ठीक है.
चलिए. Okay, we'll stop over here and we'll meet on Monday. Thank you.